Good afternoon and good morning. This is the 1447th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Jineshwar Yaligouda. Let us begin the session with 1 minute silent prayer. Thank you all. Let me introduce the guest of the day, Professor Dr. Jineshwar Yaligouda. As you know, he has completed the MD in homeopathy and is working as a professor and HOD in the Department of Anatomy, GULABRAO, PATIL, Homeopathic Medical College and Hospital, Miraj, SANGLI, Maharashtra. He has more than 26 years of teaching experience and he's an author of several books, and that one book is named as 25 MCQ'S in Human Anatomy, and has published articles on different subjects. One subject is the role of homeopathy physicians in organ and tissue donation and body donation at ground zero. And he has won many awards. The best NSS program officer in 2013-14 by government of Maharashtra and SAMAJ RATNA PURASKAR of state government of Maharashtra in Mumbai, and Dr. G.K. Gosavi Memorial Social Work Award, Miraj, and the Best Teacher Award, GULABRAO PATIL Homeopathic Medical College, Mirza. And he won the Best Award, Dr. Award in Swami Vivekananda Medical Visions, Sanjeevani Hospital, Mumbai, and on the COVID Barrier Award by the government of Maharashtra. As you all know, he has presented so many sessions in this forum, both in our Hindi as well as in English sessions, and is a person who know much about anatomy. He is a person always talking about anatomy in a different part, the application of knowledge of anatomy in practice also. That was a subject presented earlier. And today, a doctor is presenting the role of homeopathy physician in organ, tissue, and body donation. So it's a very, very vast subject and a very, very important subject to watch. And let us proudly welcome the guest of the day, Professor Jineshwar Yaligouda. Welcome, doctor.
Thank you, sir. Can you hear me?
Yes, yes.
Okay. So on this platform of International Forum for Promoting Homeopathy, I am presenting 5th time on this platform, and I am going to present today the session for the day is one of the important things which is I am going to deal is everyone should know this one topic, that is a role of homeopathic physician in body and organ donation. So in this, what homeopathic doctors are going to do or what they are going to see or whatever they are going to present, that you have to remember. So my first intention is in this is to make you that there is a one thing which is you have to remember. Most important part is role of homeopathic physician. We are not in the same field or which is we can contribute in the body donation. So what we can, homeopathic physician can contribute, that we are going to highlight today. So, sir, can you see my slides?
Yes, yes. The first slide is there.
Oh,
with the today's sessions poster. Okay.
Second, you can see, sir.
Yes, it's already.
Okay. So as a homeopathic doctor, what I am teaching 26-year anatomy, what the medical students are facing different issues for the body donation. And when we teach the anatomy, in that time, we are going to see the many things which are faced by the different students also and relatives also and different doctors also. So that I am going to include today, this is August, that is the 3rd August we celebrate as one of the National Organ Donation Day, and 13th August we celebrate as one of the World Organ Donation Day. So it is a very important that this organ donation day world, the time is begin. That is a very, people are waiting list is goes on increasing. So that what we have to do is that here we have to concentrate all the homeopathic people who are working in the basic field in the health source. So they have to concentrate on this. And I am going to appeal them that you should have the basic knowledge and you can help the society. So this is my main intention behind today. Whatever I am going to present today is that is the role of homeopathic physician in that is a organ donation, and we can go do the body donation and also tissue donation. So as I have already told you, that is awareness is must. So organ and body donation by the homeopathic physician, as he is one of the prime health professional, as I have told, he is one of the prime professional working who can make the very help in the regard of the organ donation and body donation. So this is a month and this is a week where we are celebrating the World Organ Donation Day and National Organ Donation Day. That is 3rd August and 13th August. And today, on the eve of this World Organ Donation Day, I am presenting this topic. As when we see the history, that is a one, or according to our legends, where we can consider as a Lord Ganesh as the first transplant recipient on earth. As you know, God Mahadeva, where Ganesh ji, where elephant head is replaced. So this we can consider as a first transplant recipient on earth as a Ganesh. So organ donation most commonly follows death that results from the severe brain injury. So there are so many brain dead people are there. So many problems where we are facing for the declaration of the brain dead people, or that is we call that is a person is dead, he is not recovering from his disease. So that condition we are going to promote that is help relatives and convince them, and that is the only one we can do as a homeopathic doctor. In India, around 5 lakhs people lose their lives due to an organ failure. So annually we are losing many people because there is no much donations, organ donations in our country. Many of them can be saved if compatible organ is available. If waiting list goes on increasing, donors are donating organs are very less. Many of them can be saved if compatible organ is available. This matching organ can only be available from donated source. In India, average ratio of organ donation is very less when we see the donations in the worldwide. But we are going to see in our India, we have only population which is the donors to the population is 0.08. It is a very less number which is we are going to get. That is, we are going to get the part per million. Means what? 1 per every 10 lakhs. So this is a 1 part per million, 1 per 10 lakhs. That is which it means. So means only 100 donors in 1.25 billion people. So this is very important to understand. With this 0.08%, we are there. So how to improve, how to increase, what homeopathic doctors should contribute, and what we have to take care, that I am going to guide. This ratio country-wise, like Belgium, Spain, UK, is about 30 ppm. That is very 375 times more than us. So it is a thinking or subject where we are very less awareness, or many other things which we are going to discuss. The lack of public awareness is one of the major cause. And in that, homeopathic doctors, we are not coming So that we have to take care, or that we have to understand. So next, what is organ donation? Briefly, I am going to guide you. That is, the organ donation means allowing a transfer of healthy organ from one person, that is a donor, to another person, recipient, as replacement of damaged organ. This process is strictly carried out according to our Transplant of Human Organ and Tissue Act. This act was passed in the year 1994, amended in 2011. One cadaveric organ donation, if you think of one cadaveric organ donation, can save up to 8 lives. So 8 people can be saved. One person, if brain dead person donates, he is brain dead, but other organs all are normal. And those persons, we are going to take the organs, and that condition, the 8 people where or they are in the waiting list, that is, they people can be helped. So this is one of the commonest thing which is we can do in the society. That is the one which we have to remember. So eye donation can given, that gives 2 people, blind people. The 2 blind people are not seen this beautiful world, who are not seen, what not experience this beautiful world. Only simple corneal donation that can be, which is going to help the 2 people, blind people, can get the vision. Skin donation also, burn people, where we can give. That is very important. Burn patient is suffering from severe pain. That is immediately only grafting skin, that pain 80% is relieved. So this is a very important thing which is we can remember about the what is the organ donation. And I have told the most important in that I am going to detail about the, that is a skin and eye, that is a corneal donation after the few minutes. So 2 ways of donation. Deceased organ donation, one which is we can get. So in this deceased organ donation, we have the one first major classification. In that we are going to get the donation after brain death, then donation after cardiac death. So these are the 2 things which is we can get. Deceased organ, person is got the head injury, major trauma, and we have the brain stem damage, or a brain dead person who is never ever going to come back and live. So that condition, this committee, doctors, that legal procedure should be done. Then only this that is organ donation can be done, and that person can save about the many peoples. So whatever this first person, which is you have to remember, that is the one which is a donation after brain death and donation after cardiac death, where heart is working, but immediately where we can take out the organs before they affect the loss of blood supply or damaged. Next, other way of is living donation. This is a very important, which is you can remember about the living donation. In this, what you can do is most important comes is donation is that is one which is a blood donation. As everyone is aware and everyone is about the thinking of the remembering about the living donation, that in that major and most important one is that is a blood donation. Also one which fall in the category, and now it is known and volunteered by almost everybody. So blood donation is the most important one, which is we know everyone. Next comes about the bone marrow transplant. In the living only, we can give the people who are bone marrow cancer, blood cancer people, where we can donate and transplant, or we can donate the bone marrow. Third one, which is comes about after natural death. After natural death, we can donate our eyes, that is a cornea, skin we can donate, bones, as well as few body parts like hands. Nowadays, surgeon is going to get the taking the hands surgically replaced, plastic surgeons and all combinedly, neurovascular surgeons, those all will combinedly work together, and they may now successful in transplant making successful, that is the hands. So this is the one which is we have to remember. Then live donation, donor is alive and donated organ like a kidney. If person is having 2 kidney, is having, so 1 kidney he can donate to the person. In the living only, we can donate, that is a second one important, that is a part of the liver. Part of the liver where liver can regenerate. The part which is removed, about 25%, is that is transplanted to the affected person. There also it grows, and here person who is donated, his liver also grows. So regeneration can take place, and 2 people can survive. This is a living donation in that. So next comes about the most important for the medical profession, where the first teacher of the medical profession is one which is we call, that is a cadaver. So in this, where brain dead by authorized committee after through test, patient direct, family members take the decision. Means what? When a person is declared as a brain dead, then we are going to proceed the relative convincing, and that is the most important task, where we can see that is the family member take the decision to donate the organs. This is carried out according to the Transplant of Human Organ and Tissue Act. So nobody is going to make the any which is a separately, or any hospital can privately, they are not going to conduct this, because this under act, where the super specialty hospitals, they are given the permission, retrieval center, transplant centers. According to that, we are going to, so that homeopathic doctor must know the nearest and nearby retrieval hospital, organ donating and organ transplant hospitals nearby his practice area. Then only we can help the people, then only we can be the part of the this one which is we are going to get in the organ donation and tissue donation messenger. So prepared and monitored, this is all which is we want to make the waiting list and donors list and recipient list by the NOTO. This National Organ and Tissue Transplant Organization. This organization will take the care of making the list, donors list, as well as we are going to make the Indian recipient and donors family are never disclosed to each other. Who is donated, we are not going to disclose. Who is received, your liver is donated or your heart is donated, and this patient in this hospital, this green corridor we have received, and that is given to the particular hospital, that patient we have transferred. This has been not disclosed. This will be kept secret according to the National Organ and Tissue Transplant Organization. And we have zonal organization. According to that, we are going to make this all activities. So next, which is comes about the body donation. As I have told just now, that is the first, that is a teacher of any medical profession is a dead body. So this one act, which is the first year medical student has to undergo, that is a total cadaveric dissection. So now National Commission of Homeopathy also has been declared that is many important clinical things and dissections and teaching methodologies and practical oriented and clinical oriented teaching should be done. So this is very important when we get the voluntarily donated dead bodies, and those are utilized, embalming has been done, and then those are used for the first year medical profession students, they are going to dissect. So nowadays we may get the shortening of these dead bodies, because these are the great people who donates bodies after their death, they donate, and they are after death also coming use. So these are in this Kali Yuga, They are the great saints. According to me, they are the great saints because these are the people who are in this world. They are helping, they are used, that is, they are coming useful for the other people. So this is very important. I salute these people who donates body after their death. So relatives also, they are willing to do so. So those people are, I call as this Kali Yuga, that is, they are the saints. They are the saints where we can salute them. So when we collect the data for the national organ donations, it is a where I took this has to be previous years back, 22, 23, and not much is changed where you can get. So here you can see the one which is organs which are kidney, heart, and liver, organ required and organ available. Now presently this organ availability is very, very less improved, not that much. So as when we go for the data according to the 2022, so here we have to remember that is the people who are required, which is one which is we are going to get support. 20,000 people are required, that is kidney, but only availability 1,684. This is not much change. Then where we can see here, 50,000 people where hearts are required, but only 339. Liver also 50,000, but where we get donors, only 708. So this indicates that we cannot match this because this is going very slow. But this is in the, that is a corona, that is a pandemic. That time, this was very less, but now it is slowly improving since last year. But period of 2019 and 20, this was totally stopped. So now my intention is that we have to contribute something. So that contribution, what I am going to guide you in the 10 points, so that you have to remember. So this is a basic thing where you can remember where the organ required is goes on increasing and organ availability is not that much, is near figure to the required. So that now we are the social worker, we are the doctors, we can help this, so that we can help the nation, we can help the people. So that I am going to do the main detailing of this, I am going to tell you. So when you get the deceased donor transplant data for all organs in India is where deceased donor, when brain dead is declared and a person is never going to come back, that time, when you go to the 2017 to 2022, here see, it was deceased donor was, that is a 773. And number of transplant was done in India, that is you are going to get 2,110. So this data which is gives in 2017 is much more better. That is, I can call 18 also, as I have shown in this figure you can see, but 19 and 20, that is we are COVID-19 pandemic. So this was very less and decreased. But as we proceeding 22, 23, again the donors and transplants are increasing. So this is a very much important time now. That is, we all has to work and we have to gather the knowledge. We are going to act as a social mediator for that is a promoting for the organ donation. So in this condition, you have to remember almost all the things which is we are going to do, that is for the betterment of the society, betterment of the nation. So that these all you figures where you can deceased donor and number of transplant. So now it is 2022-23 also it is much more increased than this previous. not the donations possible after natural death. So the next kin of relatives can make this donations where according to the Act of the 1949. So suitability of body donation. There are various factors that render the body unacceptable for the anatomical donation. And the sum of these may not be obvious until the time of death. Are used to study the normal structure of the whole human body. So as I am talking about, this is for the body donation. So in this, you should know the body donation, where you can remember that is normally all donated bodies are not accepted. So this, as a doctor, you should know the which bodies are not accepted. For rejection are the autopsies done bodies, decomposition done bodies we are not going to take for the medical education, obesity people where there is extreme obesity, extreme emaciation, death from contagious or communicable disease, and suicide or the homicide, or the removal of organs, any tissue. These bodies are not going to be accepted for the, that is a medical student study, as a body donation for the medical student study, that is the dissection, for the dissection. So this is a very important one. Which next I am going to highlight you, that is the eye donation. Very important in this also we have to remember, that is a corneal transplant we call. This is done after the death within a stipulated time period, where this is the first donation where we can always help after the immediate death of the person, where we can inform to the nearest eye bank. Then within the 4 to 6 hours or 3 to 4 hours, within that team has to approach and they are going to take the cornea. So only cornea is going to be taken, and that is the one which is very important. I have told, if it is a proper, very well optical cornea, one word is used, optical cornea is there, means healthy, very good condition cornea is there, that we take, means we can, 2 layers of cornea can be separated, again we can transplant it for the 4 people. This is very important. Optical cornea, if you get the people, in that we are going to make this 2 corneal donation by 1 person, 2 eyes corneal donation. We can make the 2 into 4. That is, 4 people can see this beautiful world. So this is a commonest one where we can work. You can promote for the donation of the eye. So this is the one very important you have to remember in this condition, that is a eye donation or the corneal donation or cornea transplant. After the death occurs, valid death certificate with the clear mention of the cause of death and the previous history of the sickness is mandatory. So once the relative given intimation to eye bank, they need to position the body such as the head is slightly raised by placing pillow underneath the head, and shut down the fans because we have to prevent the dryness of the cornea. Then close the upper eyelids and keep the wet cotton or the cloth cotton wet, which is on the both the eye. That was, which is we are going to prevent the damage of the cornea. So this is very important, which is you have to remember. And then you already informed to the nearest eye bank. That team will come and that you have to inform, and they are going to collect the cornea. So this is a very simple one where we can do here much more. Body donations in the dead people, we can promote, and here eye donation we can do. Already I have told blood donation. This is very important where we can get. And we have our nearest area. You should know the knowledge of the eye banks where they are present nearest. Within 20 to 25 minutes or the half an hour, this team will reach. Then they are going to do the minute surgery and they will take the cornea. Then next comes donation, that is a skin donation. In this small portion of the skin from the back and leg of the body is separated from the expert surgeon. Dermatome is there, which is only removes the upper layer of the skin, and this portion is then sterilized and preserved in the skin bank. Similar to the eye bank, the body is covered properly so that the after effects of skin retrieval are not visible. So that this retrieved skin is very useful for the grafting on the 4th-degree burn injuries. When we do that is a grafting on the burn patient, immediately 80% or the about rate of that is a chance of survival will be increased. So that pain reduced by 70 to 80% on the spot. Then we can, mortality rate can be reduced 90% or the 80%. So this is very important, which is we are going to help the people, burn patient, because the burn patient is having the severe pain, and that pain and infection, and that should be prevented. So that we are going to promote for that is a skin donation. So next is which I have told the one person is donates or the brain dead person, and he can save many people, 8 to 9 people, where his organs can be transplanted and useful. So here we can, most commonly donated organs are, so this is very important. Here you can see the eyes or the cornea, just I have told. Kidneys, here I have told the living donation, 1 kidney can be donated. And after death or the brain dead person, we are going to take out the 2 kidneys. Heart, lungs, we are going to take out. Then we can donate from or take out from the brain dead people. Liver, this is the organ where which living also I have told, living you can donate the part of 25% of liver. Then pancreas, where you can see the pancreas where we are going to get it. Then intestine, skin and bones. I have told the eye, skin, bones can be donated. So these all are the people where they're needed. These are all organs are donated. So this is a very important thing which is you should know. The time duration for this organ donation, and within this duration period, the organ should be retrieved from the retrieval centers. That is, we get the heart and lungs can be preserved for 4 hours. We can take out, and within the 4 hours reaching area, the retrieval and transplant center, it has to reach. Liver can be preserved for 10 to 12 hours. Then pancreas can be preserved for 4 to 6 hours. Intestine can be preserved for 6 to 8 hours. Kidneys can be preserved for the 12 to 18 hours. So this is very important one, which is we are going to see, that is the almost all the things which are required, needed, homeopathic doctors' knowledge is this one. And here we are going to understand what is the time duration, and within that retrieval centers, from the retrieval centers, it has to reach to the that is a donate or a transplant center. So this is a very important thing which is you have to. Organs required now, availability of organs are very less. As I have already told this, we are going to 20,000, 50,000, 50,000. As availability is hardly 1,500 kidneys, that is 1,684, heart 339, 708 livers available, but required you have to see in thousands. So that 20,000, 50,000 and 50,000. So this is a very mismatching. So we are going to promote the organ donations in brain dead people, and that procedure, which is very important, and that is done at the centers, that is the travel centers and the organ transplant center. So this is the one thing which is we can contribute in this. So next comes India's organ donation rate in one of the lowest in the world. As in the introductory part of I have already told that is the India's organ donation rate is 0.86 per million. So you are going to get the India's organ rate, which is 0.8, I have told 0.86, where you can see. So USA 31%, Spain is 46. Spain is the highest one, which is you are going to see. So this is a one which is we have to understand and we have to work. So this is the one India's organ donation rate in one of the lowest in the world. Next, basic requirement to the transplantation program. So in this, what basic things which are required and the supports which we are going to require is governmental agencies. These are very cooperative, then only we can proceed, our contribution will be the successful. So national non-profit organization and approved legislations. These are the basic requirement to transplantation program. Then public at large, positive attitude and culture towards the organ donation. So we have to convince them, we have to, any donation, any daan, that is very valuable and it is a good. So that convincing we have to make it. Medical community means medical community enforce knowledge, skill and training centers and many organ transplant centers in our area, then only it is possible to work. So this is one of the most important thing. Issues and challenges for the organ donation are high burden in relation to the demand versus supply. As I have shown the data, which is showing the donors and recipient, that is a very big gap. So it is in thousands and in hundreds we are going to get. That should be matched, but it is a very challenging for us to improve the that is organ donation. Poor infrastructure, especially in government sector, hospitals, and poor rate of brainstem death certification. This certification has been done by the ICU, organ transplant, organ retrieval center only. So that these hospitals are very important because they may take time for the declaration. One thing which is we have to remember is that is a challenges which are we are going to proceed is that is a one relation. Poor rate of brainstem death certification is there. Poor awareness and attitude towards the organ donation is there. Relation to the poor deceased organ donation. Lack of organized system. So there is a very gap, that is an organized system for the organ donation and deceased donor. That should be the proper manner should be there. Then only this system will be effective. Then next, which is we are going to get is that is the one which is you have to remember, that is a maintenance of standards in the transplantation, retrieval and tissue banking, and prevention and control of organ trading, high cost, then legal hassles, organ donor funds to help donor family financially. These all things should be the challenges and issues which are. So most important is today's my topic is what is the role of homeopathic physician or doctor at ground zero. I have used ground zero because we are the main health worker, main Ayush people, where main important people who are working at the society, health guider, as a health caretaker. So these are the points very much important to understand the homeopathic physicians. So I am going to guide role of homeopathic physician or doctors at the ground zero. In this, you have to remember Homeopathic physician being a society for the health assessment and treatment. He is the main source for the society to advise, guide, give the treatment homeopathically, giving advice. He is the main person, so that he will be the main person for the organ donation promoter. And homeopathic physicians should understand the situation and promote the same. He will be the psychologist, he will be the mediator, he will be the promoter. So understanding the situation with his good knowledge of organ donation, he may promote the, that is a situation for the understanding and promoting, that is he can very well do, and he can do this, and that is why this is the main role of homeopathic physician. Then first he should have detailed knowledge of all information relating to the organ donation, body donation, center detail, as I have told, procedures and body donation, what are the durations. So these should be known very perfectly by the homeopathic physician. Because of lack of knowledge of these organ transplant centers, retrieval center nearest by us, then only, if we don't have the knowledge of these, don't have the awareness about these, you are going to, how you are going to promote. So this is the one thing which is you have to remember. Then fourth point where I can focus, homeopathic physician should become a bridge for the organ donors, family and near relatives, pursuing them. He can be a psychologist to the organ donation, involving social, psychological, and also religious support, respecting tradition and allowing them time. So this is a very important. He can act like a bridge for the organ donor's family and near relative, and he can be psychologist. He can understand the people's mind, patient's condition. According to that, he will be the promoter for the organ donation. Fifth point for the homeopathic physician is, homeopathic physician should become a coordinator and promoter and create a bonding and good relation with the donor family. Being a dedicated health professional optimizes the donor. Means as you are the family physician, if you are supposed to be a belong to the family physician, in that condition, you are going to be a act like a coordinator and promoter, because we are not going to do the surgery, but we are main problem, main where is the region where we have to work, then it can proceed. Their working persons we are. So that homeopathic physician should take the lead of becoming a coordinator and understand the family situation, understand the donor's family condition, and dedicated health professional we are. So then only the people can they agree, and they can do ready for the organ donation. Then sixth point where I can highlight, that is he should provide social support. Suppose if we are ready, that family already you have convinced brain dead persons are there, then dead person in the ICU, that time retrieval center, organ transplant center, you have to provide them religious, cultural, social support, and after the post donation course. Only after, only previously, before donation only our work is starts and ends. No, it is also there after the donating, the family which donated his family members organs. Then after cultural, social, religious support he needs, that we can provide them as a family physician or as a doctor. Then being a coordinator, understand their needs, grief, misgivings, and misunderstanding. We can very well understand if we have the knowledge of organ donation. then only possible that we can misunderstandings we can remove, help them tied with the crisis and support the family choice. So according to this, the family choice we can give and do. He should be the part of the improver of the organ donation awareness. So he will be the main part for the improving the organ donation, conducting the health activities, marathons, walkathon, newspapers, social media, social awareness, radio, TV program, etc., using the mass media as a medium for effective communication. So we are going to create the awareness. We are giving the, that is a, he will be the improver of organ donation awareness. Homeopathy physician is a medical social worker working at a ground zero. So he is a main source. Even we are rural and interior in the, we are providing the health services. Then that time I have used the ground zero, donate organ and save lives. The role of homeopathic physician is the key role, so that he was the working in the most interior part of the where health services are not provided. There also he is available. So there he can act as a social worker. And 10th will be the, he should take initiative effort in the society for organ donation awareness campaign and become a role model in the society. He should become a first, take the knowledge and become a role model in the society, and what you can do better for the society, and become a good convincing and coordinator for the organ donation. So only it is possible when you have your details, nearest organ transplant and organ donation retrieval centers and all. So my conclusion and appeal to all homeopathic physicians, that is, if you understand all this organ donation and retrieval centers detail, what is organ donation, then it is possible to be we are the part of this one, which is awareness campaign. So homeopathic physician or doctor should know concept of organ donation, then necessity of the donation, then process of the donation, and authorized institute near you, and fact against the misconcept, and benefits to the society. So all these you can know, then only it is a possible, that is if homeopathic physician, if he knows all these. So my conclusion words and appeal to all the homeopathic physicians, you should know the knowledge of concept of the organ donation. You know the necessity of the organ donation. You should know the process of the donation, how authorized institutes you should know, and benefits for the society. If you know, you will be it is a main role of the homeopathic physician in the field, that is organ and tissue donation and body donation. So please participate by registering pledge to donate organs, spreading the necessity of the donation, removing the misconcept in the people mind, support and guide the family of your nearest and dear ones, because if they are donating, you are the role model, you are the coordinator, you should be the social worker. So this is the one which I wanted to say. You should know the organization which are monitoring organ donation. We have the NOTO, ZOTO, and SOTO. So NOTO, National Organ and Tissue Transplant Organization, Delhi, and ZOTO, Zonal Organ and Tissue Transplant Organization, 5 zones. SOTO, State Organ and Tissue Transplant Organization for the state, and ZTCC, Zonal Transplant Coordination Committee. So these words are familiar for the person. So homeopathic physician. So this is the one which is you are going to remember. That is these are the main thing which we can remember and act as a role model for the society. So this is the role of homeopathic physician in organ and tissue donation, body donation at ground zero, you can call, or it is where basic need, that is a health worker, health professionalist that is we are working in the country. So we are the part of the promoters of the organ donation and body donation. So this is my today's topic, where we have understood the main importance, what is organ donation, what are the most important thing where we can help them. 8 people can donate that are saved by the donating one person. Brain dead people declaration, hospitals are going to be trained, and all government support should be there. Then only it is possible. So my aim is to guide you as a homeopathic doctor. That is, you should be a role model in promoting the organ and tissue donation, and for the medical profession, that is body donations. So thank you very much for the important topic of this month, which is August, as celebrated as a World, that is Organ Donation Day. And I got the opportunity to present on this platform, that is IFPH, that is International Forum for Promoting Homeopathy. I thank all the team which is guide us, and also Dr. Sahani sir, Dr. Danish sir, and Dr. Kalyan Sarupji. So thank you very much. I appeal once again, you should be the part of this organ donation. Only it is possible where we can get the knowledge of our nearest centers of organ transplant and retrieval center. So thank you very much inviting me on this platform, 6th time. That is, I am very much proud to be a part of this and present this topic on today's day. Thank you very much.
Thank you, Dr. Jineshwar Yaligouda, sir. It's really a very good session indeed. You really show why the organ donation is important and how one can participate in donating the organ or tissue or anything, as well as how one can join the team, and how a homeopathic doctor can lead from the front to get others to donate their organ or tissues or body part to another person. So this is a beautiful session, and particularly in connection with the World Organ Donation Day. Really, you need more appreciation from all around us and all of us. Thank you once again for your excellent session. I hope everybody enjoyed the session. Dr. Ram Paresh sir, you can say a few words too. Please unmute yourself. Oh, I think there is a network problem with him. Sir, it's possible you can say a few words as the time is.
Yes. Yes, sir. You can.
Yes, you are already unmuted. You can simply speak, Dr. Paresh sir. No.
Thank you, Ramesh, and congratulations, Dr. Jineshwar. Excellent session, organ donation, benefit, knowledgeable seminar. Very thanks. Benefit to society, organ donation and tissue donation. Thank you, sir. Behalf of IFPH, very thanks. Again, presentation. Thank you.
Thank you, sir. Thank you very much, sir.
Thank you, Dr. Tomorrow we will have a session from our beloved Professor Dr. Kalyan Swarup, and Dr. will be speaking about values of hereditary. We sincerely thanking Dr. Jineshwar Yaligouda for such a wonderful session in this evening, and those who participated in the session also. Hope all of you will be there with us at the same time. Thank you all. A good night.
Thank you very much, sir. Thank you.